Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Sonya Makhni. She's medical director for Mayo Clinic Platform, and Dr. Michael Docktor. He's CEO of Doc Health. Welcome.
Thanks for having us.
Thanks for having me.
Yeah, excited for this discussion. Some really interesting innovations with data and enabling different companies that Mayo Clinic Platform's working on and the work at Doc Health. So excited to dive in there. But before we go there, Sonya, why don't you kick us off? Tell us about yourself and Mayo Clinic Platform.
Well, thanks again. It's great to be here. So, as you said, my name is Sonya Makhni. I'm a medical director of applied informatics at Mayo Clinic Platform. And where I sit is really at the intersection of clinical care, technology, and the data science piece. And so I wear a few hats, and really a big part of my role is focusing on how to translate technologies into workflows in effective, responsible, and trustworthy ways. And doing that at Mayo Clinic Platform, which, is an initiative by Mayo Clinic to kind of support that transformation of healthcare and bringing together high quality data, innovators and clinicians, and sort of breaking down the silos and providing the tools so that we can hopefully progress forward our healthcare ecosystem.
Awesome. Great to have you here. And Mike, tell us about yourself and Doc Health.
Yeah, thanks. So I'm Mike Docktor, co-founder CEO of Doc Health, and I'm a gastroenterologist by trade. Just came out of Boston Children's Hospital, where I was doing a little bit of similar work to Sonya in our clinical informatics group, and as the clinical director of innovation. So really, Doc Health is the embodiment of the learnings and some of the pain that I had as a busy clinician. And really what we are is trying to solve the operational challenges of healthcare. And so we are a productivity platform that helps manage all the administrative and operational tasks of patient care, to do all the stuff that I was challenged to do as a busy clinician. And so we work with teams to really turn their processes into more structured and accountable processes to bring high reliability into organizations and help manage the sort of operational stuff that typically isn't handled in the EHR.
Yeah, the stuff that no one wants to do but has to be done. I love it. What a great vision. Sonya, talk to me. Why was the Mayo Clinic Platform created? And tell me more about the mission and vision of the organization.
So about five plus years ago, Mayo Clinic Platform was created with the mission of trying to bring high level Mayo Clinic quality care to the rest of the world. And kind of implicit in that task is trying to crack the code of technology. So we've had AI algorithms exist for quite a while, and a lot of times they, live in a journal, and they're maybe a research project. We have other technology tools outside of AI. And when we think about bringing healthcare to all, and that's challenging. And so really what we need to do is figure out how to also understand how technology can play a role and do so safely. So Mayo Clinic Platform was created with this vision of how do we transform medicine to actually improve the care of serious or complex diseases across the world, just as we would in our own facilities. And this mission is hopefully we can accomplish this mission through sort of an integrated approach of clinical practice, education, and research. So that's really what we're here to do, is bring all of Mayo Clinic behind this mission of trying to solve healthcare in a larger scheme, grander scheme.
Yeah. I mean, that's a big vision there and
Yeah.
an effort, but I think it's valuable because I think we all want care from Mayo Clinic, right? But I think what implicit in your name, Mayo Clinic Platform, is the fact that it's a platform for other people. So talk to me about how the platform works with digital health companies.
Absolutely. And so, one other sidebar is, when we're during this journey, we kind of realize that a lot of improvements are incremental. So we really have to rethink how we approach innovation and the new models of care delivery and innovation that go along with that. A platform is actually one example of that, and that's the one we are trying to kind of implement. And so implicit in the platform model is you try to connect the dots between these disparate parts of the ecosystem. So we have, like I said, data at one side is at the core, to most innovations, and we have innovators, and we have healthcare providers. So we try to work with each of these pieces. And so you ask about the digital health companies. So what we try to do is meet these entities wherever they are in their journey. So whether they're at the concept phase and they're trying to develop a model, or they're ready to actually deploy a digital health solution into a clinical workflow, we try to offer what those entities need. So that could be data science and technology capabilities that actually enable these startups and solution developers to actually take their innovation from concept to market. We also have a massive repository of high quality, clean, de-identified data, and the tools to innovate and discover that we can allow innovators to actually get in there, access data in a way that's secure and hopefully faster than the normal methods, and that can allow them to kind of create algorithms with less friction. And we offer the validation capabilities to actually ensure that these models perform as they're intended to, so that we can be transparent and clear about the performance and bias, so that end users understand how to use these solutions. And the last mile, right? You can develop a great algorithm that has limited bias, but then you really need to get that model into the clinical workflow at the point of care so that the clinician or the end user can actually access it. So we have the full spectrum of deployment technologies so that solutions can be seamlessly integrated into workflows as well.
Yeah, that's amazing. And Mike, I mean, I guess that's where you really come in. Doc Health is available on Mayo Clinic Platform. So, you know, as a company that works with the platform, why did you decide to work with Mayo Clinic Platform? You had lots of options. You'd built some of the stuff yourself. So why did you decide to work with Mayo Clinic?
Yeah, I mean, first and foremost, Mayo is just a phenomenal name in healthcare. Their name is synonymous with innovation, and similar to sort of my roots at Boston Children's Hospital. It's an organization that understands innovation and really puts into action. And so having their endorsement and being part of the solution studio as one of the first members was certainly an exciting honor for us. And we're also I'd like to think innovative in it ourselves, and so happy to work with organizations to help them improve their model. And it's been a phenomenal collaboration. And I think, the reality is, as Sonya started to mention, distribution is often the challenge for particularly early stage healthcare startups. And so we've been around for 5 years and have learned a ton since we spun out of Boston Children's Hospital. But getting the sort of validation and the access to the enterprise is something that it doesn't come easily, even with an MD at the end of your name, and even if you come out of an academic medical center. So having the validation and the opportunity to work with a wonderful organization like Mayo is a great opportunity. So we're excited to be part of it.
Yeah. What would it have taken to kind of get your solution off the ground without a platform like Mayo Clinic Platform?
Yeah, I mean, to the earlier point, healthcare is hard, and we all see the stories on LinkedIn of these amazing companies that go from 0 to 60 in 3 months, and it doesn't happen in healthcare. At least it probably
Yeah,
isn't happening anytime soon.
very rare.
And the workflows are critically important. The understanding of the clinical and administrative needs of the organizations are super nuanced, and of course everything from security and compliance, and just battling the incumbent just resistance to change and the technologies that are currently in place. It's a battle, frankly, and I think that distribution is a challenge, and having a partner like Mayo, who has again a phenomenal name and thought leaders, and have the sort of process in place to not only vet solutions but also help distribute them in a way that's more turnkey than the generally quite painful process of implementing in a hospital. The old adage of if you've implemented in one hospital, you've implemented in one hospital. That still remains true in 2025, and I think Mayo is really doing a great job to facilitate that process to be more streamlined for both vendors and their hospital partners.
Yeah, Sonia, I mean, is that what you hear from the digital health companies that want to work with Mayo Clinic Platform? Is that it's about distribution, or is it about access to the data? You mentioned the validation, which I think is fascinating, or is it all of those things combined? You know, what's the compelling reason for the Doc
Yeah.
Healths of the world to work with you?
Yeah, I mean, it can be any or all of those things. So, like I said earlier, we really, understand that different startups, different innovators are at different places in their journeys. So, we could have a brilliant idea out there and a great solution that could be very narrow and not generalizable. They might look to a more diverse data set like ours to see if they can fine tune their model and make sort of improvements to the solution overall. And the full spectrum also, we understand that adoption requires trust. So
Mm.
validation and showing that those solutions are actually, at least transparent, but also showing their efficacy in a way that's easy to digest and standardize is also tremendous value when solution developers want to go to the health systems and say, like, hey, this is what we offer and this is how it performs and this is how it performs in different data sets. So that's extremely valuable. And then, of course, that deployment piece and that distribution aspect of actually getting access to health systems. And I think it's all of the above because truthfully, we need all of those components in order to actually build the trust that will lead to adoption because we could have dozens and hundreds even of great solutions, but if healthcare providers don't understand or trust those and can't follow that journey, it will be a little bit more challenging to actually adopt them.
Yeah. No, you're right. And that's to Mike's point, right? It's hard to standardize it across hospitals and to build that trust so that they can implement the solutions. So that's fascinating. Sonia, when it comes to working with provider organizations, how does the platform, collaborate with other provider organizations as well?
Yeah, absolutely. So, just a brief step back, I've been on the side of trying to intake solutions that are exciting and potentially game changing. And then also on the side of, okay, now I have to assess all these different types of solutions with different marketing materials, different value propositions, having to figure out who the clinical champions could be, the workflows, and then the limited IT budget of maybe one or two of these a year. And so I've been on that side and it's extremely difficult because you want to run fast as a healthcare organization, but you can only go as fast as, your rate limiting step. And that rate limiting step can be any of those pieces I just mentioned. So what we try to do when we work with healthcare providers is actually streamline and make that process easier. And we do so in a lot of ways. So, one, we understand that there's a technology component. So onboarding disparate solutions, there's a maximum that a health system can do per year. So by providing our technical framework and our tools, we can sync with existing EHR and IT infrastructures so that we can alleviate those burdens on the IT teams so that, each additional solution is incremental rather than a whole new lift. Like Mike said, one health system is one health system. So now how do we solve that challenge from a big picture? And that's kind of how we tackle from the deployment standpoint. But as we also spoke about, there's also concerns of credibility, safety, usefulness. And the reality is that clinicians are busy. They don't have time to, earn a master's degree in data science, in addition to practicing clinical medicine. And so we have to help in demystifying some of these technologies so that they can make the decision of what's useful for them and their practice. As clinicians, we spend 10, 11, maybe more years learning the pros, the cons, the indications, contraindications, the risks and the benefits of any given treatment. So an AI algorithm that might implement in their workflows or in their clinical practice is no exception. So recognizing that need to kind of bring some clarity to the space that falls short of passing over hundreds of pages of documents, we've developed a proprietary process that we call qualification, where all AI solutions that, are available go through this process that's multidisciplinary involving some of our top clinicians, at Mayo, our data scientists, informaticists, statisticians, and other experts to sort of take a look at the big picture of these solutions and to help communicate an intended use, the value, the clinical and algorithmic performance, and to do so in a transparent way that's also digestible. So from both of these sides, we can kind of tackle the technology piece, and then we can tackle some of that change management trust piece. And we help the solution developers in sort of bringing to light things that we know that healthcare systems are asking for, things that we know that they're going to want to know, so that that intake process that the healthcare providers have to go through is more streamlined, and hopefully they can understand the value of the solution a little bit better, and the solutions that pass this process are then made available to them, so they know that there's been some level of vetting that's gone into it.
Yeah, maybe I'll just insert, sorry to interrupt,
No,
with
go for it.
our experience, we're a unique solution in that we're a productivity tool for healthcare. We are, task collaboration and workflow automation. And so it hits we're not doing clinical algorithms per se, but the Mayo team has been phenomenal with us in helping to vet our solution and getting it in front of the right people. And as Sonya said, sourcing some of the pain points. I mean, we are a very flexible and configurable platform, and we can be applied in many areas, particularly on the administrative and operational side. But knowing exactly what the pain points are, referral management as an example is something that like we're hearing over and over again, or onboarding of new patients, or there's so many sort of processes that there's very little structure and accountability to, or automation, so they're terribly manual, terribly inefficient, and that's sort of where we've focused, and I think just working with the team has been great to help surface some of the pain points among the Mayo Clinic hospital network, and of course just validating our platform and providing that credibility factor.
Yeah.
And it's been great.
Yeah,
Oh,
go ahead.
sorry. No, and it's been, we often find these conversations, to Mike's point, a really, valuable exchange, because I think what we want, we recognize that this is a team effort, right? We need to help get those, the Mike doctors of the world. They have these brilliant ideas, they have these technologies. And if we can kind of figure out a way to harness the power of the collective, we can start to make change that's less than incremental. And I think, Doc Health is exactly a great story of kind of how to exhibit that. So, I'd echo his sentiments that, a great experience in sort of sharing this collaborative nature where we work together as kind of teammates in this journey.
Yeah. Well, and there's so much low-hanging fruit in healthcare, but there's only so much bandwidth because many organizations are just overwhelmed with the operational minutia of what's required, regulatory wise, reimbursement wise, et cetera. So, they need help to vet the right solutions and implement them. Mike, talk to me about AI in healthcare. And implementing these types of solutions. How do clinicians know that a solution is trustworthy? Obviously, Mayo Clinic Platform's providing some validation, but, how do you build that trust with clinicians that they're like, okay, you're going to take away this operational challenge for me, but I need to know it's done right. I'm sure that's what you hear from them. So how do you build that trust and know that the solution's going to work?
Yeah, I mean, it is a balance, and I'm gonna defer to Sonia for a lot of this because I know she's an expert. But in our experience, and certainly, we just launched our Doc Intelligence platform just back in January, so we're still early in this journey. But I think the key, it is that balance, right? It's first of all being transparent, and being explainable, digestible, as Sonia said, which as a GI doc, I appreciate that word. It's being able for, it feels like magic. I mean, this is an amazing technology. And I think we're all moving at the speed of light right now, but being transparent, certainly on the security and compliance components, obviously validating both through Mayo and through real world experience with our customers and the clinicians on our team, myself included. And so having, validation of that, and certainly applying all this HIPAA and regulatory issues is a no-brainer and sort of table stakes. But being ensuring ethical and bias mitigation, being thoughtful about the output of your LLMs and making sure that there's bias is sort of accounted for. And I think where we've really approached it from like a user experience is really just, continuous monitoring to make sure that what we're getting is something that feels appropriate and ensuring that there's a human in the loop. So, for us, there's low-hanging fruit, as you said, John. We're handling mostly administrative and operational tasks that are clinically adjacent. We're not doing clinical decision support per se, and I think that that should be held to a higher level of scrutiny and certainly testing and validation. We're providing summaries of all the tasks that are being done in our platform and hoping to write those back to the HR if appropriate or communicate those to other team members. So, the sort of risk on our side is a little bit less than it might be if, we're suggesting, a treatment per se. But keeping a user human in the loop to ensure that the output is reasonable before any action is taken. So here's the summary of all the tasks and workflows and some clinical context about this patient. Do you want to write this back to the HR? And here you can read it and edit it as appropriate. And then beyond the sort of real-time editing of the output and ensuring that there's a human in the loop, just gathering feedback from users. And we have, within our AI summary, we have right at the bottom, like, click this link to take a survey of the output and give us feedback on what worked, what didn't work. Was it, was it accurate or not? And so I think in these early days, and again, it is moving super fast. In these early days, I think it's important to be transparent and open and have a sort of fair amount of skepticism that, like, this isn't perfect quite yet. There's still hallucinations and there's still, it seems like the data is increasingly suggesting that this is really impressive and accurate, but we still should, carry a little bit of skepticism and ensure that we're not entirely relying on the system on its own.
Yeah. I mean, I hear the transparency point, the explainability is a big topic here. And it is interesting how, like in past automations, you just had to make sure it was still working, whereas with AI, it adapts, it changes to the context. And so I think your point of following up with it regularly is an important one because of the nature of AI, changing over time. We have to monitor it in a much different way than just a task-oriented automation. So that's fascinating. Sonya, what else would you add beyond what Mike shared?
Yeah, Mike was spot on, completely agree. There's really a few principles that we like to follow. And these principles are, coming from CHI and other leadership organizations, ourselves included. And, a solution, like Mike said, needs to be transparent and somewhat explainable. We can't explain the most complex of algorithms, but at least we should try to explain that that's the risk and that these are hallucination risks that might happen and so forth. So I think spot on there, spot on with the security and privacy as well. Those are cornerstones to any innovation, AI or not. And we also need to understand, these solutions need to be useful. They need to show that there is some demonstrable efficacy, whether it's an outcome, a performance metric only goes so far. We need to understand that they actually benefit patients and don't cause them harm. So safety is a big one, as well as fairness. And so not every solution, can and will be perfect. We won't find a solution that has perfect outcomes and have zero bias and zero risks. But in being transparent, like Mike said, we can at least help arm the end users with the ability to make those decisions for themselves. So they can take a solution with a grain of salt. They can understand maybe this solution isn't as generalizable to a certain population. So perhaps a little bit more clinical judgment is required. And so I think these components are the building blocks to helping garner that trust and understanding, for clinicians and end users of how to use a solution, and doing so in a way that's scalable and doesn't, add to the issues of burnout that we're already experiencing, will kind of help ensure some sort of a practicality component. And in addition to those principles, for generative AI, as Mike mentioned, there's other considerations that, have to be more nuanced. And so we have developed a set of guardrails and guidelines specific to not only just AI in general, but generative AI as well. And in trying to kind of expose what those are and sort of understanding to our end users, the hope is that they can, mitigate any sort of misunderstandings, and also, like I said, goes back to that cornerstone of trust and transparency. And, and all of that together, and Mike mentioned this really well, is, this could be a great solution. It might not be perfect, but with a little bit of patience, we'll get there. And I think that kind of shared responsibility is really helpful, and just giving the tools to all sides of understanding what's important and understanding how to decipher that is a really big piece.
Yeah. I mean, I think that's something it's easy for us to say the tech should be perfect. And I think that's such a flaw. We should be comparing it against the alternative, not against perfection, as much as we strive for perfection in what we do. So I think that's something we've learned in AI for sure, that, we want it to be perfect, but we should compare it against the alternative, which is humans, which are imperfect as well.
Well, and, and that's also challenging, right? Because the way I look at it is, it sometimes is about what's the alternative. Sometimes it's hard to measure that.
Sure.
But I think the standard that we can set for all of our tools is that hopefully they get us closer to sort of narrowing that gap of, as you mentioned, imperfection. So, we are maybe imperfect as humans, but hopefully our tools help reveal those biases and not propagate them. So, what we try to do in sort of demystifying these solutions is to not just expose the biases of the solutions, but also doing that can also help us understand our own biases. So, keeping in mind that nobody in this ecosystem is perfect, human or machine, but kind of together we can get to the place where we improve each other's, the machine and human, is I think the goal we strive for.
Yeah. Well, Sonya, Mike, you were perfect in this interview, helping us understand what you're doing at Mayo Clinic Platform at Doc Health. I appreciate you shedding some light and some understanding on the most important topic in healthcare right now, I think, which is how do we leverage this AI to improve what we're doing and improve the lives of patients and, of course, those people who serve the patients. So I appreciate you taking time to talk with us, and thanks so much for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks a lot.
Thank you.